You're listening to americaswebradio.com, the pioneer and leader in chat radio. Thank you for listening.
This is Doug Field, CEO of the Institute for HealthCare Consumerism, and welcome back to HealthCare Consumerism Radio. In this segment, we're going to continue our discussion on this emerging, fast-growing private exchange marketplace. And joining with us today from Benefitfocus, one of the leaders in HR benefit, communications, administration, and education space, and now one of the leading providers of private exchange platforms, is Shan Fowler, Director of Product Management and Marketplaces. Good morning, Shan.
Good morning. Thanks for having me.
Yeah, how are you today?
I'm doing great. Great, thanks.
You coming to us from Charleston?
We are, yes, Charleston. A little bit cool out here, but probably still warm for most of the country, so yeah. No complaints.
Same for us over here in Atlanta. We're, we can't complain too much when we're talking to people in Connecticut and Chicago. So. Well, exactly. Shan, talk to us a little bit about our audience, a little bit about what Benefitfocus is doing and specifically doing in this, private exchange marketplace.
Sure. So Benefitfocus is a technology company. We're a software as a service cloud enrollment benefits provider, solutions provider. So what we do is we provide enrollment and billing and anything that really surrounds the enrollment experience or the enrollment benefits experience for both employers and for the the health insurance carrier and also other insurance forms. So our tagline is all your benefits one place, and what we do is we provide a very consumer-centric online enrollment shopping experience so that you can go through as an employee or as an individual and select your benefits all in one place, go through the process as much as possible all online, and then as an HR administrator for an employer, you can go through and manage your population and the enrollment needs on an ongoing basis.
Now, Shan, one of the things that's going to take place, the private exchanges is the wild, wild west right now, but open enrollment for this year is going to be the wild, wild west because everybody's going to have to do it underneath some new criteria. What are some of the essential things that employers should focus on during this year's open enrollment?
Well, I think that from the employer perspective in particular, one thing that is very critical is really that communication of all of the changes. So certainly you have so many different scenarios, whether you're a small employer or a large employer is going to change what message you're giving to your employees. So really what you want to do is make them smart consumers, because the bottom line is that with the changes that are happening, by and large it's going to require that employees or individuals are going to be taking on more of the time and the consideration for selecting their benefits. So whether that is going along with a high deductible health plan, whether it's understanding what changes they're seeing to their plans because of healthcare reform, the challenge is making sure that they understand that. So that the employer is not getting, from our perspective as Benefitfocus, so that the employer is not getting, hit with all of these questions, or, in turn, so that the health insurance carrier is able to, field the questions as they come. And I wanted to touch upon that area that I talked about with, like, the changes in plans. Certainly there are changes in terms of, essential health benefits and the actual plan designs that we're going to be seeing. But what we're seeing among a lot of carriers is that the notion of a renewal or sort of updating your current coverage just with a new rate is going to be something that particularly this year for this open enrollment is going to be a challenge, because there are so many changes that healthcare reform is requiring that health insurance carriers are essentially creating all new plans for them. Right. And they're trying to match them up as much as possible with existing coverage, but it may be, especially in that when you get, down market into the smaller businesses, there will be a lot of changes, and so communicating those changes to employees, I think, is a great challenge.
Yeah, and surprisingly, I think to a lot of us in this business, health savings accounts married to high deductible plan have come out very, very well to sit in the exchanges. Agree?
Oh, absolutely, yeah. Another thing that we look at as far as that goes, and again, this is sort of a communication challenge, is how coinsurance relates into that, and because of how the new models for out-of-pocket maximum that we see at some carriers and so forth. So, yeah, absolutely. I mean, the high deductible health plans, if anything, they're going to become extremely, alluring to the average consumer. And really because, they may also have more options. For those who are going directly to a public exchange for their coverage, certainly they're going to be the lowest cost plans that you see out there. So I think you'll see a lot of consumers are going to sort of gravitate toward these plans.
Now, one of the things that, employers have a lot to think about right now, and one of the aspects that was created underneath the healthcare law was the pay or play. Do I pay or do I play in some type of option? Can you speak a little bit to that? What might be best for, say, an employer with 50 employees or an employer with 10 employees?
Yeah. So, and it is, that's sort of the sweet spot, if you want to call it that kind of that area where if you go from 49 full-time employees or 50 full-time employees to 51, then all of a sudden all of these different considerations go into effect, and primarily that pay or play. Like I am now, as an employer, required to provide my full-time employees coverage or I face a penalty. And I think that, part of this is that there is a strong financial decision to be made among these employers. But, the other part of it is that what we see is that depending on it's very dependent upon your industry as well. So if you are in an industry that has traditionally covered all of your employees anyway, there may not be as much of a decision to make between 45 and 55 employees. Whereas if you're in an industry like retail or the restaurant business or any of these things that have a largely hourly population and in a lot of cases a low income or a lower income population, then it's a really serious consideration because first off, you're looking at a penalty where before you may not have had it or you didn't have any penalty, and secondly, you want to do the best by your employees. So, it may be that you're in a business where it actually makes more sense for you to pay the penalty and let your employees go out to a public exchange and see if they are eligible for subsidies, and that's your best bet in providing your employees the best level of coverage. On the other hand, it may have such a broad impact on your business that you have to make those tough decisions. And so I think you've seen that a lot in some of the recent press that's gone around. There was the whole Papa John's thing about, say, the pizzas were going to go up in cost, and Wendy's. There were some Wendy's and Applebee's franchisees who were saying, we're essentially not going to be able to provide coverage because of these new rules and the economic impact they're going to have on us.
Right. But I think you go upstream to a lot of the mid-sized and large employers. The consensus is they want to retain the ability to provide, health care and benefit coverage to their employees for a lot of sound reasons, one of that being, retention of a skilled workforce.
Oh, yeah, absolutely. And I think that you see time and again, we've read studies from Aon Hewitt and Mercer and Towers Watson and you name it. They all essentially say exactly what you just said. Not only do we think that we're still going to provide benefits, but we almost see it as more important now because it's a real differentiator in the market.
For what you're doing with Marketplace, coming back to, some clear differentiations, it seems to have been, with your footprint in this space as one of the leaders in communications, enrollment, and administration, the Marketplace was just a natural extension for you, correct?
Oh yeah, absolutely. We've kind of joked that back as long as I've been here since 2007, we've had this notion of marketplaces in mind because of healthcare consumerism. And we saw just a couple of months ago Kathleen Sebelius started calling the public exchanges public marketplaces.
Right.
They even have that when you go to healthcare.gov now. So we like to think they were taking our lead, but it really has been that the notion of a marketplace and the focus on consumerism is something that's really been a key factor of development for us. We've always kept it in mind.
So would you think that all healthcare reform, do you think that helps or hurts, the concept of healthcare consumerism?
I think that you got to take a look at it in two levels. You have this, this chaos that's going to happen this year, and I think that you're going to see, rates that may sort of go counter to the idea or some of the ideas of the quote-unquote Affordable Care Act. But I think that once things settle down, the evolution is toward healthcare consumerism. When we talk about it internally, we always remind ourselves that healthcare reform didn't come about, because policymakers wanted to sort of stick their nose into the space. It came about because there was a real need for consumerism, and there was a real need to address costs and what that impact has on individuals. So we like to keep that in mind. Certainly, if anything, healthcare reform has really accelerated some of the things that I think we've all been talking about for years. And I think there's going to be a real kind of disruption this coming year, but once things settle down and you start to see some real trends, I think that healthcare consumerism is just going to be more important than ever.
Now we sing the same song. Obviously, the genesis of the Institute for HealthCare Consumerism that has now grown to over 70,000 employers and health plans, advisors, and brokers was that healthcare consumerism is a legitimate megatrend, and
yeah, absolutely.
Economic impact, policy impact may deter it or slow it down a little bit, but it's here, and we're probably in about the 9th or 10th year of that megatrend, and it takes about 11 or 12 years to really fully mature. So we actually agree with you.
Yeah, I agree.
Hey, Shan, time flies when we're having fun. This has been really informative. So we got about a minute and a half to go, and I want to give you the chance to really kind of close out this segment give our audience some clear takeaways about what Benefitfocus is doing in this space.
Sure. So, I think that our focus is, on providing the whole benefits solution for our customers, whether they're employers or health insurance carriers. And we're unique in the space that we do have that dual focus on both the payers and the employers providing the coverage to their employees. And what that has led us to is that we have always focused on the end user, on the consumer, because ultimately that's what is, that's who the other constituencies are looking to make sure that they're happy and that they are getting their needs addressed. So I think that's, has been a key driver for us and a key advantage of us. And so we're very much in lockstep with the work that you're doing. And we think that it's, if you go from the bottom up, you really solve the problem, much greater.
Well, listen, we appreciate you being with us today and enjoyed this segment. And you have a great weekend over there in Charleston. And to our audience, stay tuned for the next segment of HealthCare Consumerism Radio.